So I am in Anchorage, Alaska, Delaney Park Dental, and I've been there for about 20 months. No, about 16 months now. So
Awesome, awesome. So I'm really just super pumped that we can kind of find some time today to kind of discuss how we've been working together for over I think the past 9 months or now. So just to kind of kick things off, if you can kind of just briefly describe kind of what you guys were doing in terms of marketing and advertising for the practice kind of before we started working together.
yeah, so when I bought the practice, he wasn't doing hardly any marketing at all, and I wasn't quite as busy as I wanted to be. So I just reached out, just tried out different things, tried some mailing campaigns. I did attempted some pay per click by myself. That was a yeah, that did not work. And and what else did I do? And that was pretty much it. I took a online Facebook course to see if I want to do some marketing that way, and I attempted that by myself. Didn't work out too hot. And then actually, while I was doing that, you reached out and um, talked about doing it, just trying it out, see how it went. And that first month, we had a few leads. I was like, well, I'll try this out for a little bit, and it's been great. So yeah, I didn't have a ton of success and especially to pull in the patients I wanted with my mailers and that. So yeah, I
Gotcha.
know this Facebook has been working out. So
Gotcha. So for the other methods of advertising that you kind of explored, you mentioned kind of Facebook, some mailers. What do you feel, I guess, could have been the most improved, or what do you feel that was lacking with those forms of advertising?
um, probably probably the right offers in place. Like the mailers that I had some offers for like implants and that, but I the only ones that wanted to come in through those were like a discounted cleaning basically, and it's just
Gotcha.
did not get the rate of return that I want on that. So I think yeah, probably a little bit of hitting the right market, and like I said, I was doing it mostly myself, so just probably didn't have as much experience just knowing who to target and what the right offers would be. So
Gotcha. So I think it was mainly, um, I guess, just targeting like the right high value patients, such as dental implant, rather than the $19 or $29 discounted teeth cleaning that a lot of Facebook
right.
marketers out there are kind of trying to advertise nowadays.
Yeah, yeah, because yeah, we got a lot of those that want
Yeah.
to come in for the cleaning, and that was about it. So it didn't turn into a whole lot. So
Right.
yeah.
Gotcha. And I guess for you personally, I mean, why specifically was growing, the dental implant side of the business important to you? Like, what has that allowed you to do now that we've kind of been working together for a while now?
So that's something I had some extra training after school to do implants. It's something I really, really like to do. I love surgery. So, especially implants, I saw what they could do for people. And so I just wanted to do something to kind of just get my feet wet and do as many as I could and, gain more experience that way. And so I wanted to get as much as, yeah, just get as much experience as I could. So,
Gotcha. Awesome. Awesome. So now that you're kind of, getting more patients, in the realm of dental implants and surgery like that, how would you say in your own words, how has your practice changed kind of since we've leveraged this, this type of, um, condition specific treatment marketing and kind of leveraging the automated text and follow up email, voicemail drops, things like that? Have you kind of experienced a better contact rate, a better show up rate, or kind of just talk to our audience a little bit about that just so they can kind of get a peek into your world.
yeah. So, um, before, like I said, my practice is mostly recare patients, and so we had, a pretty good case acceptance. Whatever would come, whatever they had, we would do. But like I said, I needed something was lacking. So this has generated a lot of leads. Um, you know, Probably get about half of those leads probably come in, and then or sure would probably make an appointment. Half would probably even show up. We do have some no shows with those, but
Cool.
that's part of having a high volume lead count, right? But
Right.
just trying to weed out the right patients. And so luckily, through the texts and the emails and that, we've had to do less, phone calls and follow ups, and we wouldn't try to plead with every single patient to come in the door, but we just kind of let the patients weed themselves out and see who would show up, who would follow through with appointments, treatment, etc. So we haven't had to worry about, if one person didn't show up for the appointment, it's not a big deal because we knew that was part of it, and we just kind of let the process weed weed them out. So
Gotcha. Awesome. That's great to hear. And then since kind of getting this influx of new patient leads, I mean, have you guys also experienced your referral network start to kind of pick up as well, and just getting kind of business from their lifetime value, their referral value? How has that kind of helped benefit your business's bottom line?
yeah, no, for sure, yeah, it has. I mean, a lot of people do those $19 specials to just get people in the door, try to make good impressions, try to gain referrals that way. Um, but I what I've liked about this campaign that we've done is not only is it brought in high value treatment, but it also has brought in, create some raving fans that will come, also refer their friends and things like that. So it's kind of great because I don't have to do discounted treatment that I didn't really want to do, but it's something that I want to do. Plus, we're gaining, other referrals out of it. So it's hard to quantify, exactly, that reach, how far it's reached out. I haven't really made all those connections, but even
Sure.
the treatment alone has been worth my ROI. So kind of adding referrals and word of mouth is just kind of icing on the cake. So
Gotcha. And I know we recently did an email blast, just kind of a patient recall type of thing, where we
mhm.
recently started, allowing people with Medicare to kind of come into the practice. Just really quickly, how has that been going? I haven't even really talked to you about it yet, but it seems like you got a decent response rate on that campaign. So
Yeah, we had a lot of last week we had a lot of people in the books. Sadly, like I said, a lot, quite a few no shows, but we did have some that wanted to go through the treatment. So yeah, we'll just kind of have to see what that materializes into the next
awesome,
little bit.
awesome, nice little bonus there. Okay, well that really kind of sums up just kind of the questions I had for you. If you kind of just want to leave our audience with just some closing comments or any particular recommendations or advice that you would kind of give, a dentist that's kind of trying to move into more doing those higher value cases and growing their business that way.
Yeah. So I mean, there's different ways to approach it. I mean, a lot of people feel like they don't want to do discounts or offer prices because they don't want to you know I don't know. They have these ideas that they don't want to put a value on the treatment, but honestly, I think it does help, and it helps the consumer know, exactly what they're getting into. So I've liked marketing this way, so the patient really knows exactly what they're getting, and yeah, I definitely recommend it. It's worked out great for me. Probably the best ROI that I've done marketing in my practice so far. So yeah,
Wow,
we're good.
that's awesome. I think it's a little bit different when you offer a slight discount on a higher value service, such as an implant, because then you bring them into the practice, and you obviously can offer more and more value, kind of as you kind of bring them up your value ladder and offer more and more services. So I think that's kind of where we're really starting to see you guys turn the corner.
Right. Yeah, I agree.
Awesome. Well, thank you so much for the time, Dr. Miles. I look forward to working with you into 2019 and seeing how much you guys grow, year over year.
Yeah, absolutely. Thanks, Joey. Appreciate
Okay,
it.
thanks, doctor. Appreciate it. Talk soon.
Okay.
Okay.